Hey everybody, welcome to Friday. Yeah. Guys, I hope you're having a great week. I hope that you are excited for the weekend. I'm so glad to be here. I am super excited to take another question. I've been loving doing these, and I'll be honest, I forgot last week. I forgot. And so I'm back this week begging your forgiveness, so that I can please let me keep doing this. And all you have to do to let me keep doing this is ask me questions in the comments. Put your questions in the comments. I love asking them or love answering them. And that's what I'm going to do today. So I got a question from Natalie, and she says, what are steps you take to make your employees feel well treated when taking their own pets in for care and not making them feel pushed to the sidelines? All right, let's talk about taking care of staff pets. The first thing about taking care of staff pets and making them feel important is the doctors and the managers, you got to take this seriously. Like, first of all, let me just pause here. And I see doctors that are like, I don't have time for this. And I've been that guy who's got a really full schedule, and someone's like, oh, yeah, Angela's cat is here. And I'm like, Angela's cat, come on. Tell her to bring him back tomorrow. And that's a normal thought you have. Don't do that. Don't be that guy. Listen, it is an honor to take care of the staff pets. If you are, especially if you're in a multi-vet practice, and one of the technicians comes up to you and says, hey, Dr. Roark, I was wondering if you would take a look at my cat. She's doing this thing that's weird. Or, hey, Dr. Roark, would you do vaccines for my dog? You should be thrilled. Honestly, this person who works with multiple veterinarians has come and asked you if you would look at their pet. What a freaking honor. We don't get medals in vet medicine. That's as close to a medal as you get, is the people that you work with having the respect to be like, oh, I respect you and appreciate you, and I would love it if you would take a look at my pet and help me with my pet. Like, man, that should make you feel good. So first of all, it should make you feel good. The second thing is this: the way we treat our employee pets, it matters. I think a lot of people are just like, hey, it's a perk that you get working at the vet clinic is like you get a price break on services, and that's just a perk. And so we do it, just because it's cheap for us and it's a perk for them. That sucks. There's two reasons that the way we treat our staff really matters, right? Number one, the way we treat our staff pets, it says loads about what we think about the importance of our services. And number two, it says loads about what we think of the importance of our staff. All right, so let me tell you what I mean here. When your technician comes to you, or when the front desk comes and says, hey guys, could you take a look at my pet? The way that we take a look at their pet shows our values. It shows what we believe in. And so if I can spend all day long saying to my staff, guys, physical exams are important. Doing a good physical exam is important, and that's why we prioritize it here at our hospital. And then they bring their pet in, and I just do the quick run my hand over the dog and go, no, it's fine, let's do these shots. All right, let's get on to the next one. What does that mean? It means one of two things. It either means that I'm full of crap when I tell people my exam is important, because I just did a quick once over on your dog. So either exams are not as important as I say they are, or it means that I don't care enough about you and your pet to do a good job. And neither of those things is okay, right? I believe my physical exams are important, and I say that those are important for pet owners. And when the staff comes in, I still believe a good physical exam is important. And so I'm going to do a good physical exam. And part of that's because I want to do a good job. And part of that's because I want my staff to know I care about them and I'm taking them seriously. And another part is that my technician is going to stand in that exam room and tell the person who just came for a vaccine, oh, physical exams are important. And I need him or her to believe it. And I want them to be able to say, Dr. Roark does a good physical examination on my pet. And even if they don't say it out loud, I want them to know it in their heart, because it just sets them up for success, right? They're speaking the truth. And I made it that way. And so I need them to believe in the importance of the exam, which means I need to do a good exam on their pet, because that's my chance to show it. Guys, talk is cheap, right? Talk is cheap. It's about our actions. And so put your hands on the pet and do a good job and treat your staff like you treat a client, and just just show them the value of the exam. And it's easy to be like, oh, well, she could do this herself. Sure. I mean, she totally could. I'll come back to that in a second. But again, it's about living your values and showing what you believe. The other part is about your staff feeling important. If we say that the medical care, wellness care is important, and then we just blow it off on our own staff's pets, like it sends the message that they're not as important as our clients. And guys, I'm really on the warpath about this these days, buddy. You want to see me get fired out? My belief is, and you guys can fight with me if you want, I don't care. We need to take care of our staff first, and then we take care of pet owners. And if we take care of our staff, then they'll take care of pet owners. But we need to take care of our staff. And so my staff is important. And so taking care of their pets, if I said I was going to do it, I need to do it. I need to do it well. And so those are some of the big things, the why things. That wasn't Natalie's questions. Natalie's question was, what steps do you take to do this and make sure they don't feel pushed aside? That's the big thing is you got to treat them. You got to treat them like they matter. And you got to put on the show. And you got to do the job and do it for them, right? And there's a couple of things about that. The first thing the steps to take is you got to have a plan. You got to have a plan, especially if you've got 20 or 30 employees and they've got 2.5 pets each. That's a lot of pets over the course of a year coming in. We just need to figure out, what is the plan when these people come in? I see a lot of vet clinics. I get it. I see a lot of vet clinics are kind of like, yeah, bring them in and we'll make it work. And then we're all slammed, right? We're all balls to the walls crazy right now. And the employee brings her poor dog in, and the dog stays in the run all day long. And at the end of the day, we're like, bring them back tomorrow. That's not cool. And so we just gotta have a plan. Do they get an appointment block? Do they get a drop off block? Right now, you gotta have something, right? They need to get treated well. So we gotta have a plan to take them in. The big thing for me is I want them to see I want them to experience what the client experiences too. And so I had a front desk person brought her cat in for me to see, and as a physical exam and just a wellness exam. And so I said, when she had a moment, I was like, hey, would you go get your cat and let's do this? And then I did the physical exam and I asked her all the questions. I did all the stuff. And I know a lot of people are like, why, let's just get it done and just tell her it's done. But I'm like, no, look, this person's at the front desk. I want them to understand the client experience very much. And the other thing is, I want to take good care of her because she basically is the gatekeeper to my schedule. She decides who gets on my schedule and who doesn't. She does callbacks for me. She does all these sorts of things. I want to treat her right, and I want her to understand what I do, and I want her to see value in it. And so I get her, and I bring her, and I do the thing, and I do the exam in front of her because that's how I show her that I care and that this matters. And so I do that. A lot of people will say, well, the techs, Andy, come on. The techs, they don't need it. They see us do a million of these things. They know that we do a good job. That's true. But let me tell you this, too. Taking care of technician pets is the best teaching moment that there is. Honestly, the best thing you can do is your technician brings their pet in and they say, well, let's do this wellness exam. Great. Do an examination and tell me everything that you find, and I'm going to watch you. And then I'll do it myself. But man, get your tech in there palpating that abdomen, feeling those joints, palpating those lymph nodes, and it's her own pet. But just have her put on the show for you. And you sit there and you watch, and then you do it, and you tell her what you find. So first of all, you better believe that we're taking this seriously. But number two, she's getting some hands-on time in front of the vet, practicing her palpation skills and physical examination skills. And guys, that's freaking awesome. And we can make that happen. And so it's just, it doesn't take a ton of time. It really doesn't. But it's just doing stuff like that. The other thing that holds a lot of practices back, people will say, oh, well, the doctors don't want to do it. I rarely find that to be true. My big things on this is if you're a vet, take care of the staff. Just it comes back. I can't tell you what a great investment that is. If they ask you to take care of their pet, be honored and just do it because it comes back to you so many ways. Treat them well, treat them good, do this simple thing with them, spend time with them. It's worth it. But I get questions about compensation. People will say, well, we do a discount for the staff on their pets. And so then do we pay the vets a regular fee for doing the thing? And I don't know. The truth is I don't have strong feelings on this, honestly, guys. I'll tell you, it all depends, right? If I've worked in a practice that had 100+ employees, there's a lot of staff pets coming in. And if I saw all the staff's pets because they like me as a doctor, and I don't, I can fill days doing that. And I go, hey, I love doing this, but at some point, I'm I'm not making a living here. That's an extreme case, you know what I mean? So it's all about your situation. Everybody just needs to talk to each other. The other big thing is just clear expectations. If the expectation is the doctors don't get paid for doing staff pets and they just take care of them, I think that's fine. But you got to say it, and just say it up front when when the person takes the job. Just say, hey, this is part of our policy. We take care of the staff's pets because of how we pay. There's a reduced compensation or there's no compensation, but this is just kind of the expectation of the job, and we think it's really important to do, and we do it. And I don't have a problem with that. I just think people get in trouble when expectations are not set and people don't exactly know what they're supposed to do, what they're required to do, how to do it, how it goes in the schedule, things like that. Just make a plan, communicate it. But this is an easy win. So bond with your staff, take care of them. Show them the value of what we do, show them the value of your services, show them that they matter. And again, just like with everything in life, talk is cheap. If you want to show somebody that they care, you got to show them they care. You have to actually show up when they need you. You have to actually do the thing that's going to help them. And so you gotta show up and you gotta do the thing and really make it count. So anyway, that's it. Those are my thoughts on staff pets. Trying to show the staff that they're important, not pushing them to the side. Just not prioritizing them, squeezing them in, doing stuff when they're not there, just to get it done. I've been as slammed as anybody. I know why it happens and how it happens, and I wouldn't say that probably haven't been times that I have done that or been at the very end of the day squeezing someone's pet in. I never like it. And so I've just, over the last couple of years, I've started really working hard to make sure, okay, when this is in, we're going to pull this person aside. We're going to really do it for them. And we're going to make them feel special and make sure that they know that we do good medicine here at this practice that they work at. Anyway, guys, that's what I got. Hope you have a wonderful weekend. Ask me any questions you have down in the comments below. I love to see them. And I love to talk to you guys next week. Take care. Be well. Take care of each other. Bye.